Bimatoprost drops are used to treat high pressure inside the eye due to glaucoma or other eye diseases. It can also help prevent blindness by regulating the flow of fluid within the eye to maintain a normal pressure. It is important to use this medication as prescribed by your doctor. The usual dosage is 1 drop in the affected eyes once daily in the evening. It is best to take Bimatoprost drops at the same time each day to help remember. Make sure to follow your doctor's instructions carefully for the best results. When using Bimatoprost drops, it's important to follow your doctor's instructions. Typically, you'll apply the drops to the affected eye once a day in the evening. Be sure to wash your hands before applying the drops, and if you wear contacts, remove them before use. To apply the drops, tilt your head back, look upward, and pull down your lower eyelid to create a pouch. Then, place 1 drop into the pouch and gently close your eyes for 1 to 2 minutes. Avoid blinking and do not rub your eyes. If you use other eye medications, make sure to wait at least 5 minutes before applying them after using Bimatoprost drops. It's important to use this medication regularly at the same time each day to get the most benefit from it. And remember, even if you feel well, continue using Bimatoprost drops as prescribed. If you have any questions, don't hesitate to ask your doctor or pharmacist for more information. Some common side effects of using Bimatoprost drops may include burning, stinging, irritation, redness, feeling like something is in your eye, dry eyes, watering eyes, and increased sensitivity to light. If any of these effects persist or worsen, it's important to speak to your doctor or pharmacist. Over time, Bimatoprost drops may cause a brown discoloration of the colored part of the eye, iris. If you are using Bimatoprost in only one eye, only that iris may change color. Additionally, an increase in eyelash number, length, and thickness, darkening of the eyelashes and eyelids, or eyelid changes may occur in the treated eye. These changes may be permanent, but the long-term effects are uncertain. It's important to notify your doctor if this occurs and to schedule regular eye exams to monitor it. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects such as vision changes, eye pain or swelling and redness of the eyelids. While a very serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. In the US, you can call your doctor for medical advice about side effects or report side effects to the FDA. In Canada, you can call your doctor for medical advice about side effects or report side effects to Health Canada. Before using Bimatoprost drops, make sure to inform your doctor or pharmacist if you are allergic to it, similar drugs, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Also, inform your doctor or pharmacist about your medical history, especially if you have any eye problems such as macular edema, iritis, uveitis, or if you have had lens extraction/aphakia. If you develop an eye infection or injury, or if you have eye surgery, check with your doctor about the continued use of your current bottle of Bimatoprost. You may be advised to start using a new bottle. After applying this drug, your vision may become temporarily blurred or unstable. It is important to avoid driving, using machinery, or doing any activity that requires clear vision until you can do so safely. If you are pregnant, this medication should only be used when clearly needed. It is important to discuss the risks and benefits with your doctor. It is also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. When using Bimatoprost drops, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Bimatoprost drops is eyelash treatment, such as topically applied Bimatoprost. Be sure to discuss any potential interactions with your doctor or pharmacist before using Bimatoprost drops. If someone accidentally swallows Bimatoprost drops, it can be harmful. They may experience serious symptoms such as passing out or having trouble breathing. In such cases, it is important to call 911 immediately. Otherwise, you can also contact a poison control center for guidance. For U.S. residents, the local poison control center can be reached at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Bimatoprost drops are used to treat high pressure inside the eye due to glaucoma or other eye diseases. It is also used to improve the growth and fullness of eyelashes. The daily dosage and the best time to take this medication will be determined by your doctor based on your specific condition. Be sure to follow your doctor's instructions carefully and do not exceed the recommended dosage. It is important to not share this medication with anyone else. You may need to have regular medical tests, such as eye exams, while using this medication. Make sure to keep all of your medical and lab appointments. It's best to consult your doctor for more information about this. If you forget to use a dose, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and use your next dose at the regular time. Do not take an extra dose to make up for the missed one. When it comes to storing Bimatoprost drops, it's important to follow the specific instructions provided by the brand you are using. Always check the product package or ask your pharmacist for the correct storage requirements. It's crucial to keep all medications out of reach of children and pets. When it comes to disposing of this product, never flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the drops when they are expired or no longer needed. Your pharmacist or local waste disposal company can provide guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.